Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're tackling a trend that should have every parent's attention: the sharp rise in chronic health conditions among children in the United States. We'll examine what the data reveal and the practical measures families can take.
Thanks, Ethan. The numbers are indeed concerning. Research covering nearly 2 decades shows that by 2018, almost 1 in 3 American children was living with a chronic condition such as asthma, attention deficit hyperactivity disorder, autism, or prediabetes. Illnesses that rarely resolve with age and instead track into adulthood.
To put that into perspective, just 2 decades earlier, the prevalence was closer to 1 in 4. Ilara, what did the Harvard Medical School analysis highlight about how quickly these conditions are gaining ground?
The investigators used National Health Interview Survey data from 236,000 individuals aged 5 to 25. They calculated yearly upticks. ADHD climbed by roughly 0.24 of a percentage point per year, autism by 0.13, asthma by 0.12, and prediabetes followed the same 0.12 trajectory. Small annual changes that compound dramatically over time.
Beyond raw prevalence, the study noted around 1.2 million young people with chronic conditions transitioning into adulthood each year. That influx stresses schools, workplaces, and healthcare systems. But not all children are affected equally. Can you break down the socioeconomic patterns?
Certainly. Children living below the poverty line faced about a 3.4 higher probability of chronic illness, and those on public insurance showed an 8.6 greater prevalence compared with peers holding private coverage. Unemployment in the household added another 7.6-point burden, underscoring how financial instability translates directly into poorer child health.
The burden is not merely statistical. Functional limitations, speech problems, musculoskeletal pain, anxiety, and depression hamper learning and social development. How do these limitations manifest as children grow?
They accumulate. A child who struggles to breathe comfortably or maintain focus can miss lessons, withdraw from play, and internalize frustration. Over time, those setbacks weaken academic performance, narrow employment prospects, and elevate healthcare costs. So early detection paired with consistent support is essential to prevent lifelong disadvantage.
Geography also matters. The research team found the highest rates in the southern United States and the lowest in the West. What environmental or lifestyle differences might explain that gradient?
Diet, air quality, and activity patterns vary regionally. Southern children are more exposed to processed foods, rich in industrial seed oils and sugars, spend more time indoors during hot seasons, and often breathe higher levels of particulate pollution, all contributors to asthma, insulin resistance, and inflammatory pathways linked with ADHD and autism.
Let's shift to mechanisms. The article points to environmental toxins, poor diet, and stress as primary drivers. How do these factors translate biologically into chronic disease in children?
Toxins such as pesticides and plasticizers disrupt endocrine signaling. They alter gene expression and immune function, increasing susceptibility to asthma and neurodevelopmental disorders. Diets high in refined carbohydrates spike insulin, leading to prediabetes, while chronic stress elevates cortisol, impairing sleep and gut integrity, both foundational systems for metabolic and neurological stability.
Autism and ADHD often dominate parental concerns. What emerging evidence connects these conditions to environmental exposures?
Several studies implicate prenatal contact with organophosphate and pyrethroid pesticides, heavy metals, and phthalates. They interfere with neural development by inducing oxidative stress. In parallel, toxicant-induced loss of tolerance, or TILT, leaves some children hypersensitive to everyday chemicals. Add electromagnetic fields and disrupted gut microbiota, and the risk amplifies further.
Another statistic that caught my eye is childhood obesity, affecting 1 in 5 U.S. youngsters. How does this tie into the chronic disease narrative?
Excess body fat drives insulin resistance, systemic inflammation, and hormonal imbalances that feed directly into type 2 diabetes, hypertension, and even asthma severity. Key accelerants include early screen exposure, inadequate sleep, low food security, and regular consumption of fast food and soda, factors that together account for nearly half of early life obesity cases.
The article also revisits breastfeeding, noting cultural pressures that shorten duration. What advantages does breast milk confer in the context of chronic disease prevention?
Breast milk delivers antibodies, immune factors, beneficial microbes, and hormones calibrated to the infant's needs, supporting gut maturation and metabolic programming. Exclusive breastfeeding correlates with lower infection rates, improved cognitive outcomes, and reduced risk of obesity and type 2 diabetes later in life. Benefits formula simply cannot replicate.
Let's turn to solutions. Parents often ask for concrete steps rather than abstract warnings. According to the article, where should families start?
5 priorities stand out. First, eliminate highly processed foods and industrial seed oils, replacing them with whole food proteins and unrefined carbohydrates. Second, reduce environmental toxins by filtering indoor air and choosing unscented cleaning products. Third, protect sleep with consistent routines. Fourth, encourage daily sunlight and physical play. Fifth, respond immediately to early warning signs.
Those warnings can be subtle. What specific symptoms should prompt parental action?
Watch for unexplained weight gain, chronic fatigue, persistent wheezing, skin rashes, mood swings, or difficulty focusing. Any combination suggests underlying inflammation or metabolic stress. Addressing diet and environment at the first hint prevents progression to full-scale disease, sparing children the compounded burdens documented in the Harvard analysis.
The study also stresses the transition gap when pediatric patients age into adult care. How can families navigate that handoff more smoothly?
Begin planning during early adolescence. Engage both pediatric and adult providers in joint visits. Secure up-to-date medical summaries, and teach teens to manage appointments, medications, and insurance details. Continuity reduces emergency visits and empowers young adults to sustain the healthy routines established during childhood.
Schools play a decisive role in shaping daily habits. Meal programs, classroom environments, and physical education all factor in. What practical measures can districts adopt to protect student health and turn these statistics around? Parents often feel powerless once children walk through the school doors. So let's identify strategies they can promote at board meetings.
Districts can start by replacing ultra-processed cafeteria options with minimally processed proteins, vegetables, and fresh fruit. Installing high-efficiency particulate air filters in classrooms, scheduling daily outdoor recess, and integrating standing desks or movement breaks to counter sedentary time. Partnerships with local farms and nutrition education modules reinforce these changes without inflating budgets.
Digital devices dominate both classroom instruction and home entertainment. Beyond the behavioral impact of excessive screen time, emerging data point to electromagnetic field exposure as a biological stressor. What boundaries or technologies can families use to minimize EMF-related risks while still allowing children to engage with modern learning tools? Parents tell us total device bans feel unrealistic, so pragmatic guidance is essential.
Start by hardwiring computers with Ethernet cables and disabling Wi-Fi overnight. Keep tablets in airplane mode during offline study. Require devices be used at a desk rather than on laps, and store phones outside bedrooms. Simple distance, holding screens at least 12 inches away, cuts exposure sharply, and blue light filters ease retinal and circadian strain.
Individual choices matter, yet systemic policy often sets the default environment. From your review of the literature, which policy actions would produce the greatest population-wide benefit for children's metabolic and neurodevelopmental health? Should we prioritize clearer food labeling, tighter pesticide regulation, or subsidies that make whole foods affordable? And how might healthcare reimbursement shift to reward prevention over treatment?
A multi-layered approach works best. Mandatory front-of-package added sugar disclosure can steer purchasing immediately. Phasing out organophosphate pesticides, as several European nations have done, reduces prenatal neurotoxicity. Redirecting agricultural subsidies from corn syrup inputs toward regenerative produce lowers costs for families. Finally, reimbursing pediatricians for nutritional counseling and environmental screening incentivizes preventive care across socioeconomic lines.
That brings our discussion full circle. 1 in 3 children now carries a chronic condition, but the trajectory is not fixed. With informed choices, early vigilance, and a supportive community, families can reverse these trends and give the next generation a stronger foundation.
Thank you for joining us on Dr. Mercola's Cellular Wisdom. We hope today's insights equip you to safeguard your family's health. Until next time, stay informed and stay well.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.